Does hyperbaric oxygen affect blood pressure? It's probably one of the most common questions that I get on this channel, as well as when I'm teaching courses and certifying people in hyperbarics. That's what we're going to cover in today's video. If you're new to our channel, I'm Dr. Jason Saunders. I'm the founder of HBOT USA. I've had over 20 years experience, and over the past 20 years, I've helped thousands of patients inside my clinics, and I've certified over 600 practitioners and technicians across 300 clinics worldwide. This is a fairly common question that comes up during our certification programs. And by the way, if you're practicing hyperbaric medicine and you aren't currently certified, please take the time, get the training, and get the confidence that you need, and make sure that you're offering hyperbaric in the safest and most effective way. So the first topic I want to cover quickly is we're talking about blood pressure, and people understand that with hyperbaric oxygen, the chamber is pressurized. And so therefore, there seems to be confusion simply around the word pressure. Does the chamber pressure affect blood pressure? And the answer from that standpoint is no. Liquids and solids are not compressible. And what that means is if you've been in a hyperbaric chamber, you don't feel that on your legs, you don't feel that on your arms or your hands. The main place that people would feel the pressure is in their ears because there's air spaces inside of our ears, and that gas, the air in that space, is what's compressible. So gases are compressible, but liquids and solids are not compressible. I mention that just to say that as the pressure of the chamber builds, it's not that the compression of the chamber is leading to increased pressure on your blood vessels. So there's really no connection directly between the pressure of the chamber and your blood pressure. That being said, while the pressure of the chamber is not affecting blood pressure, the hyperbaric treatments overall do have an impact on blood pressure in two different ways. One, during the session, and next, long-term after repetitive sessions over time. So let's talk about during hyperbaric. Oxygen, and in particular hyperbaric oxygen, is a vasoconstrictor. In other words, as your body's being exposed to higher levels of oxygen, and with hyperbaric, you're getting pressurized oxygen, which makes the response to oxygen even greater, there is a vasoconstriction effect of hyperbaric oxygen. What that means is the blood vessel diameter will shrink. Just like if you put your finger over a hose and blocked some of the flow, you'll see the pressure of the water coming out is much greater. Similarly, as we vasoconstrict, as the diameter is shrinking, the pressure of the fluid inside that tube will go up. And so as a result, there is a short-term increase in blood pressure from that vasoconstriction. Now, studies that have looked at this have also shown that that increase in blood pressure is very mild and almost insignificant. We're talking about 6 to 8 millimeters of mercury on both the systolic blood pressure as well as the diastolic blood pressure. Those same studies have also compared the effect of people who have hypertension or high blood pressure and people who are not diagnosed with hypertension. And it has not been shown that there's any statistical difference between a hypertensive and a non-hypertensive patient going into a hyperbaric chamber. Both get this 6 to 8 millimeter rise. These studies have also only really evaluated blood pressure at higher pressure, so 2 atmospheres or above. I have not seen any literature that has looked at lower pressures, let's say 1.3 to 1.5, and its effect on blood pressure. But what we could say is the higher percentage of oxygen and the higher concentration of oxygen, the greater amount of vasoconstriction. So we would expect to see a lower effect of blood pressure at lower pressures of oxygen and a greater amount of vasoconstriction or a greater amount of increase in blood pressure at higher pressures. As one side note, for someone who is hypertensive and is taking an ACE inhibitor, that also seems to have a protective effect against the rise in blood pressure from hyperbaric oxygen. So for me, this rise of blood pressure is relatively insignificant. And unless I have a patient whose blood pressure is incredibly high and or completely unregulated, it's very unlikely that blood pressure alone would stop me from having this person do a session. Other studies that I've looked at have also shown that while there is an increase in vasoconstriction with hyperbaric, and that vasoconstriction often leads to a small rise in blood pressure, subsequent sessions have also led to lower rises in blood pressure over time. In other words, the first few sessions have a greater impact on blood pressure, and as sessions have continued, that impact goes down over time. What that also tells us is there's an adaptation that the body is going through as it's getting used to being exposed to these greater pressures of oxygen. Along those same lines, we can start to talk about what's the effect of blood pressure over time. So not only after a few sessions, but now after 20, 30, or 40 sessions. Well, just like in the first few sessions, the impact on blood pressure, which was higher in the first session or two and starts to get lower after 3 or 4 sessions, what we often find is that long-term, we see even lower levels of blood pressure. Now, that's typically only seen in people who are already hypertensive. In other words, if you have normal blood pressure and you get this rise in blood pressure on single sessions, there's really no long-term effect that you're now going to have lower blood pressure or lower than normal blood pressure. I've not seen any evidence of that clinically or in the literature. However, those with hypertension, we do start to see a lesser effect in each individual session. And then we often also see lower blood pressure overall after a series of sessions throughout a protocol. Why do we start to see that? There's a few reasons. Number one, we start to see changes in the autonomic nervous system. And so as somebody who might be sympathetic dominant or fight or flight dominant, right? There's two parts of the autonomic nervous system, sympathetic and parasympathetic. So the sympathetic is fight or flight. The parasympathetic is rest and digest. The sympathetic would cause vasoconstriction. The rest and digest typically causes vasodilation. So an increase in vessel diameter, which would have an opposite effect on blood pressure, lowering blood pressure. So as we get balancing of the autonomic nervous system, we start to get more normalizing blood pressures. We also see a release of nitric oxide as a result of hyperbaric oxygen over periods of time. And that release of nitric oxide is also a vasodilator. And so after 10, 15, 20, 30, 40 sessions, consistent balancing in the autonomic nervous system and consistent release of nitric oxide, we start to see this vasodilatory effect have a more long-lasting impact on blood pressure overall, which will usually result in an overall decrease in blood pressure compared to the mild to moderate hypertension that they started with. So I guess there's two questions here. One is, if I have hypertension, should I avoid hyperbarics? And or if I have mild to moderate hypertension, is this a treatment for me? So from the standpoint of, is it dangerous or should I avoid hyperbarics? I would say typically no. Again, you'd have to have incredibly high blood pressure and or very unpredictable blood pressure in order for me to feel that hyperbaric was unsafe to go through. And studies that have looked at hypertensive patients and compared hypertensive to non-hypertensive patients don't seem to have much impact overall from an increase in blood pressure standpoint. On the flip side, I would also say that I don't think that hypertension would be the standalone reason that somebody ought to go through a full hyperbaric protocol. Now, quite honestly, blood pressure alone or hypertension alone is typically a symptom of other issues, not the problem in and of itself anyway. And so if somebody has autonomic nervous system imbalance, well, hyperbaric could help balance that and as a result have blood pressure come down. But I wouldn't be looking at hyperbaric as the treatment for hypertension. Will hyperbaric normalize blood pressure in everybody who has hypertension? No. Clinically, what I would say is depending on what your blood pressure was prior to treatment, we would see a mild increase in the first few sessions. That increase would decrease over time, and then your overall blood pressure will start to decrease over time, maybe back to a normal baseline, most likely lower than whatever it was that you started with, but depending on where you started and how many sessions you did would really influence whether or not we're getting you back to normal blood pressure levels or not. Hopefully, this information helps calm your fears, whether you're treating people with hypertension or you yourself have high blood pressure and you're considering hyperbaric, but you're not sure if it's safe. I'm trying to provide some guidelines for you to better understand the impact of hyperbaric oxygen on blood pressure. Now, if you yourself or a loved one are looking for hyperbaric and blood pressure was a concern, please make sure that you're also consulting with an expert in hyperbarics before you go in to make sure that it is the right fit for you. As always, I appreciate your time and attention, and I'll see you on the next video. If you're a practitioner or you're looking to get into hyperbarics and you're wanting to learn more and making sure that you're offering this therapy as effectively and as safely as possible, I want you to know that we offer a series of courses, some of which are online and some of which are in person. At thehbotcourse.com, we'll include a link below. We have several courses available from training and certification in hyperbaric medicine, safety director, as well as a few different business implementation options to get the business up and running. So if you think that training and education would be helpful for you, take a look at thehbotcourse.com. Again, the link will be in the description below.